It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
In addition, we have back from sabbatical, PA Lydia, everyone. Hello, PA Lydia.
Hello.
And anyway, we'll talk about you in a minute. And NP Mel B, also back from sabbatical.
Hello.
And you brought your guitar, right?
I did.
Okay, we're going to do that when we record the podcast, so the Sirius XM folks won't be
Tortured.
subject to that. Yes, this is a show for people who never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for medical news, podcasts, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And check out my work on Normal World with Dave Landau. I just did one on fecal transplant that literally derailed the rest of the show.
I was driving here thinking about fecal transplants.
Oh, really? Were you
Yeah.
just thinking about these things
I don't think
randomly?
they're that disgusting. I was just,
No.
I was just thinking about it.
Well, one of the points I made was first off, how are you going to make money off of it? Because you're using people's literal shit. Mm-hmm. But then, how are you going to do the clinical trials? It's like, oh, hi, you're depressed. Can we take someone's liquid stool and shove it up your rectum and just see if something happens? And so it's a little bit difficult to do those. Although there is a company in Canada, of course, that sells artificial stool called Repopulate. And I don't know if it has, because it is artificial, it's just bacteria, a colony of bacteria, whether it has as much beneficial effects as actual stool from somebody.
You wouldn't think so.
I wouldn't think so because, there are nerve cells in the gut. It's called the enteric neural pathway or whatever, but it's called the second brain. And when there is inflammation in the gut, it actually can affect your mood and things like that.
Oh, yeah.
And if you take stool from one person to another, you can affect their mood. And I just wonder if the Repopulate would actually do that. I doubt it because it didn't come from a human being.
Yeah, and it'd be less likely to elicit an inflammatory response, right?
Well, true, that too. Yeah, this stuff is supposed to improve inflammation. People with Crohn's disease or ulcerative colitis, there's actually data for that. They started out just using it for pseudomembranous colitis, a.k.a. C. diff, Clostridium difficile.
Used it for that.
Yeah, and for the refractory cases of that, you can take healthy stool bacteria, give somebody an enema with it, and it actually can resolve the problem by just replacing the bad bacteria with an overwhelming amount of good bacteria. But then they found that people they did that who had ulcerative colitis actually got better too. So there's some decent data for that.
Right on. Mm-hmm. That's good stuff.
So just, shitting in a bucket and then adding a little saline to it and then giving somebody, an enema, it's unbelievable that actually would have some effect, but it does.
That's great. Hey, speaking of shit in a bucket, I've got a bucket full of shit for you out in my truck.
Oh, you do?
I did. Yeah, I cleaned my koi pond. I scooped you off some super duper
fish.
koi poo.
Yeah.
Is that good for
the garden?
plants?
For the gardens, yeah.
Yeah,
Nice.
It's good for the garden.
I've got him a fancy little bucket out there full of fish.
I'm growing nothing but soybeans this year, so I'm replenishing my soil. So that'll be good for it.
It'll be great for
Yeah,
it.
thank you.
Certainly.
All right, good deal.
Right on top.
So anyway, check that out on Normal World. That was fun. But yeah, at the end of that one, They were so distracted by my 3 minutes of talking about fecal transplants, it just completely derailed the show.
Funny.
And that's sort of my goal. The first one I did was on Fournier gangrene because they asked me what's the worst way to die, and I said, "Oh, there's one answer for that, and it's Fournier gangrene." And do not Google image Fournier gangrene. It's Fournier.
Space.
Right, space gangrene, and it disturbed them so much that it again derailed the show for a while, and they kept trying to move on and kept coming back to it. And if I had known it was going to have that effect, I wouldn't have made my second one deviated septum, But I'd already had it in the can, so to speak. So, but anyway. All right, check that out. Normal World with Dave Landau. Dave is the sweetest, nicest person in the business. And I know some really nice people in the business, and they would all say the same thing. So he's just great to work with. And Allison Lerman, who used to work for Compound Media, she's been my liaison over there. And Angela Boggs, I might as well give everybody a shout out. Bryce and Ken and Sam and all the people that work on that show, they're just wonderful people. So it's really fun to work there.
Cool.
Anyway, it'd be nice to make some money off of some of this stuff at some point, but that's okay. The reason
Wait, we're making money?
no, like I'm saying, it would be nice. It would be nice.
We're on a 20-year plan.
Right. What I'm hoping is someday one of these people will become so famous that they'll put me in their movie or something like that.
That'd be cool.
Yeah. Actually, Pete Davidson called me. Yeah. Said, if you can be up here on Thursday, I can put you on my TV show. We've got a place for you. And it was like, I can't just, I just can't do that. His lifestyle, he can just pick up and go, hey, we need you for a commercial on Friday at midnight. And it's like, okay, no problem. But I can't do that. So that was a missed opportunity.
Things to do.
Yeah. I hated that. I really wanted to do it.
Well, that'd be fun.
Anyway, I now have an IMDb page now.
Oh.
I don't even know what that is.
There you go.
for-
See, that's how important it is.
I'm so excited to be in the presence
That is awesome, isn't
of
it?
someone
No,
with
but
an IMDb.
He's a DB pager.
What was crazy was Tacey had one way before me. And because of, I probably shouldn't. You know what? I got to go back.
Well, check that one.
Hang on.
Oh, he's going to read. Well, that must be serious.
No, she doesn't want to. And could I be more redundant? I said now twice. The Department of Redundancy Department. But anyway, yeah, because of my acting work on Normal World, I have an IMDb page.
Congratulations.
I know. And Mel B doesn't even know what it is, and that's fine. That's how unimportant it is. But it was kind of cool.
Sounds highfalutin.
It's the Internet Movie Database.
Ooh, God.
So if you've ever been in a movie, even if you've been, a bit, if you've gotten a credit, you end up on the IMDb. It's just a database. Well, it's kind of cool. And I'm on there as Dr. Steve, which was good. All right. Well, let's move on. Enough about me. A couple of things. I've had people reach out to me about Lady Di, in other words, Diana Orbani. She was a regular on Opie and Anthony. She was beloved, but frustrating because she was an alcoholic and she was just a degenerate alcoholic where you could never get her to stop drinking. And at the end, after O&A went away, she would call our show when we were taking live calls, and I would say, Diana, are you calling from rehab? And she's like, oh, no. And it was click. I had to hang up on her because she had made a promise that if I paid her rent 2 months in a row, because she was getting kicked out of her apartment, and I talked to her landlord. She's going to go to rehab. Will you just hold her apartment? We'll raise the money to keep it because I just don't want her to be homeless again. And he said, yeah. And he was all in. And then she just never went. And so, we just couldn't keep doing it.
Yeah.
And but she eventually was diagnosed with Wernicke-Korsakoff syndrome, which I'm going to be doing a video on that very soon for my, Weird Medicine one-shots. I did one on borderline personality disorder. I'm going to do another one on Wernicke-Korsakoff syndrome. But it's a dementia. Ultimately, it's a dementia that's caused by thiamine deficiency. And sometimes, even if you supplement them with thiamine while they're drinking, they still get it because the alcohol and the changes in their liver make it impossible for them to actually absorb the thiamine. And but anyway, we found out as a fan base because she called. It was either Opie and Jim or Jim and Sam. And it was like, oh, we haven't heard from you in a while. She said, yeah, I'm on a naval ship. I'm in the Navy. And then that's when they realized, we really can't take her call. She can't even give consent to be on the air. And, well, that was the right thing to do.
Sure.
So it was fun making fun of her. And everybody made, and she was a good sport about it until she became seriously ill, and then it wasn't funny anymore.
Yeah.
And it wasn't funny anymore, before all of this, because she just wouldn't stop, and she was homeless, and she was blowing hobos and stuff. I mean, there's videos of her. I'm not speaking out of school, so it became very sad. But I have good news. I talked to her son. She's doing extremely well. She's in a nursing facility, still with dementia, still thinks she's on a naval ship. That she was in the Navy, and that was the one thing in her life that she was kind of proud of, even though she was discharged from the Navy. But she did serve her country, and she was very proud of her service. So that's kind of what she's gone back to. So yeah. So that's the good news. There is a GoFundMe. If you go to my Twitter feed, I posted a GoFundMe link. Her son raises a little bit of money for sodas and treats and stuff like that she enjoys.
Good.
And God bless Lady Di. Anyway, there you go. Now, Lydia, you haven't been here in a while.
I know, guys.
So
I've been everywhere, man.
P.A. Lydia. Oh, we could do that song at the.
I've been everywhere.
Yeah, we could do that, and Lydia could sing it.
I don't think I can get all those words out of my mouth.
I know. Yeah.
That's a lot of words.
You got to get closer to the mic, too.
Yeah, I'm sorry.
Scott. That's okay. Just pull it closer. So, Lydia, we were doing the saga of your breast implants.
Oh, yes.
And that is complete.
It's complete.
And you look, I love this new sort of paradigm with you wearing the sort of sundress because you always, that's not really a sundress, is it? What is that? What do you call that?
I guess it would be a sundress, just like a linen dress.
You always said you couldn't wear sundresses before.
Yeah.
And now you can, and you wear it very nicely,
do
by the way.
so much. Thank you very much.
Yeah. So you're just showing.
Very, very pleased.
You paid money for it, and you're showing it off. Good for you.
Yeah.
Yeah. So has it changed your life? Do you?
Yeah, well, I can buy bras and underwear that much.
Okay, that's not what I'm talking
I'm just kidding.
about, but-
I know.
Nobody
so certainly
cares.
certainly some confidence. Listen, don't boo me. Certainly confidence for sure.
Yeah.
It's really funny with different interactions. I'm going into a different profession now.
Yeah.
More like.
Oh, and they didn't know you from before.
They didn't know me from before, right? So now the people who know me, like, have had like supervisors and current bosses say, "Oh, I wonder how you got that job." As they unbutton
get
their
out
shirt.
of here.
It's so freaking weird, but I don't care.
That's horrible.
Yeah, so I mean, overall, 100% positive.
Yeah,
Totally
yeah.
good.
Cool.
Yeah.
Do you have to go, oh, hey, my eyes are up here to people now?
No, I just let them look.
Yeah, because sure.
I'm not that revealing when I dress.
You paid good money
but
for it.
whatever.
No, you look great.
Thanks.
You look great before, but you look great.
Any pain?
No.
Any residual pain?
No.
Cool.
No. Do you have sensation?
Yeah.
Yeah.
If anything, heightened sensation.
Really?
In like a positive way.
Yeah. I wonder if
Yeah.
that's psychological.
No, I don't think so. I mean,
think it's physiological?
Yeah, and the physician, I spoke with the surgeon about that, and he said some people don't regain sensation, others do report a heightened sensation.
Well,
So,
good. All right.
yeah.
New nerve endings are made after the
Yeah.
surgery, I guess.
I guess so.
Maybe.
Nice.
Way to go.
Yeah, it's good.
Mel
Highly
B?
recommend.
Yeah. Okay, good. And Mel B, how are you, my friend?
sleepy.
Are you sleepy? Okay.
Yeah.
Yeah, you've had quite the time. I don't know if you knew, PA Lydia, Mel B had her thyroid removed.
Oh,
and we showed pictures on here and got a content strike.
Wow.
Yeah, it was pretty. It was an
show you
impressive
pictures.
thyroid.
Was it a
Yeah.
large thyroid?
Yeah. Well, it was a large nodule.
Yeah. Oh my goodness.
Yeah, it was sweetbreads is what it is. I mean, I could just say, this is what sweetbreads look like.
Yep.
People, if I was a chef channel and I put that exact same picture saying, here's what we're cooking up today, YouTube wouldn't have had a problem with it.
Mm-hmm.
But anyway.
It's awesome, isn't it?
Oh,
Now
wow.
that is a nodule.
It's nice to see the lobes of the thyroid and that nodule.
Yeah, and that's something.
It's impressive.
Ugh.
I could still mostly swallow.
Okay. That's good.
You swallowed to one side, couldn't you?
So I do want to make one announcement, and this is just for the people who know. So those who know, and those who don't, it's okay. I just want to thank everyone for the support from every corner of this universe. It's really humbling, and it's so appreciated, and it's never going to be taken for granted. And I'll explain to you guys later what I'm talking about. But like I said, those who know. Anyway, so we were going to talk about gross things and drug shortages and stuff like that. I've got a couple news stories. But before we do that, actually, PA Lydia has a story. Tell us about this massage and give us the background. This sounds crazier than hell, this kind of crazy massage. So
Yeah.
tell us about this.
Yeah, we were just chatting because prior to the show, we were talking about old school massage parlors that gave happy endings or
Right, and
manual relief.
They said
And so,
manual relief. They had signs out
it
there.
uncovered this suppressed memory that I had from about a month ago.
No.
So I got tired of paying for the expensive massage because, like, you might as well be asleep, right?
Yeah.
I want that, like, good deep tissue for less. So,
Yeah.
so I've been going to this local place run by a female and male. They're Chinese. They don't speak any English, so we communicate through
through dollars.
Cash,
dollars
yeah,
and
through
Google
cash, yeah.
Google Translate.
Okay. Yeah.
And they do. I had been a few times. They did a great job. Very intense. Like they'll have you hang from like a pull-up bar.
Okay, this is the part.
Anyway.
This sounds like something from a
But with clothes
Eli
on.
Roth movie.
But
where
with
you're
clothes
hanging
on.
from these bars.
Yeah, they really like stretch you and all this stuff.
Okay.
So anyway, I go back, and this time the gentleman is going to be their masseuse. And so I'm like, okay, well, it's not weird. I'll be okay with that. So anyway, I'm lying in the room.
He's a professional.
That's lit with cheap Christmas lights, and he. So when you get a massage as a female, you normally will take your top off, right? You don't wear your bra, and you just keep your underwear on, and then you're always covered. Do you
I
not?
thought I was supposed to get naked.
Oh, you get naked?
I do.
Oh, well,
Take
see,
it all off.
she's not going to be disgusted by this story.
Well,
So
there you go.
anyway, he starts getting started,
Yeah.
and he just pulls down my underwear and gets on top of me,
What? Oh,
and
what?
just like straddles me on the table, and I'm
Now, are you
thinking,
face up or face down?
I'm face down.
Okay.
Yeah, face down. He's on top of me on the table. This is just and so I'm getting the feeling,
Yeah.
and I'm like, I don't want to be rude. I want to accept the massage, but so I have to. I keep drawing new lines
Excuse
for
me.
myself.
Can you ask a question though? Like, is this part of the normal massage?
He doesn't understand that.
Oh my god.
He doesn't understand
That's
that.
that's
Weird,
an
man.
excuse.
That's
So you
weird.
literally can't talk, right?
Yeah.
Yeah.
And so then I keep making these new boundaries for myself. And if anybody knows me, I have a difficulty with boundaries.
Yeah.
So I'm thinking, okay, if I feel something, I'm definitely going to get up.
I'm crawling out of here.
Like I know if I feel something, I'm going to get up.
Yeah.
But it ended up just being like a really intense massage of my butt.
Oh, wow.
Of my butt.
But okay, did it have to be skin to skin though?
And yeah, I was gonna say,
I mean,
can't
were you
do it?
wearing like thick felt underwear?
Granny
No,
pants,
I
yeah.
wasn't. I was wearing like
Yeah.
no, like bikini
Yeah,
underwear.
Yeah.
Cheeky bottoms, not a thong. It wasn't like pull me down.
Yeah.
See, fabric gets in the way, though.
Yeah, it does. I know.
Yeah,
I
I
would
think it was
say-
the combo of like pulling it down, which was a first for me,
And climbing on
and
top.
climbing on top of me,
Yeah.
and definitely having a full view of all of my privates.
Yeah.
That was a bit awkward. So anyway, I left, and I'm thinking I'm never going back.
Yeah.
But I still left a tip. So my friends
Sounds like he left a tip.
give me so much shit because they're like, "You tipped him."
That is bizarre, dude.
So I'm gonna go back to the other
place
more expensive
where
place.
they don't straddle you.
Yeah.
Well, I've seen these massages in other parts of the country where everybody's naked and then they're just taking your limbs and bending them ways that they're not supposed to, and then they're slapping you and doing all this stuff, and it's supposed to be good for you. But
Well, now that
like
sounds
that.
like that sounds like you're describing kind of a Thai massage.
Or Turkish too.
Yeah, Turkish. I think it's a
Yeah.
Turkish
Because
massage.
Thai massages are really aggressive. They're stretching, kind of almost like a yoga kind of stretch and massage, and it's really aggressive. They like start at your toes and start manipulating and like manipulating.
I think I would like that.
It's actually wonderful. Yeah, and those I love. But I don't think I would love somebody straddling me. And
pulling my
No, thank
underwear,
you.
pulling my underwear down first. That's just
pulling my underwear down, and then climbing on top of me. No,
Yeah,
thank you.
It was the O feeling.
Yeah, that reminds me of talking about getting the prostate exam, and then the urologist cleaning up after the. Remember us talking about that years ago? How you didn't you have a prostate exam with somebody after they checked your prostate? They kind of wiped you up and cleaned you up for you.
No,
Do you remember that? Do you remember
So
that show?
tender.
no,
We
I
talked
would
about
do
that
that
years ago. No, I know you didn't do it. But
Here, you got to learn this. You got to learn this phrase. You ready?
Yeah.
不，谢谢。
Boo shishya.
What's that mean?
That means no thank you.
No, thank you.
Right.
Shisha.
Shishya is thank you.
Yeah, I
and
know
boo
shishya.
is no.
Okay.
Or you can say boohow. Boohow. Boohow means bad. Boohow.
不，
Boohow.
谢谢。
Boohow. Boohow.
Okay.
Boohow.
Boohow. Boohow.
So you can go back. Now
Okay.
now you can set boundaries.
There we go.
Boohow.
Thank you.
Boohow. Bad.
I'll just keep my Google Translate on the table.
Boohow.
Yeah.
Boohow.
Can right. Can you put my underwear on, please?
Would you mind sliding my panties back up?
Back up. Thank you.
Oh my god! How
man.
so weird, man.
It was a lot.
That is. So
I have to say I didn't enjoy the rest of the massage.
No, you must have
Oh,
been.
hell
What
no.
happened after that?
I
You
was-
probably don't even remember.
I was pretty mortified the whole time. Yeah.
So much for taking a nap and enjoying.
I'm going to go back to the soft.
I mean, I take naps in the MRI. I'm usually, and when I get my teeth cleaned, sometimes I'll fall asleep. Here you go. This is another a statement that you need to learn. Okay, you ready?
Yeah.
Oh wait, no wait.
请把我的内衣穿上。
Qingbao.
Okay, you ready?
请把我的内衣穿上。
It means put my underwear back on, please.
Please.
That's right.
I'll save it.
Oh, that's hilarious.
Wow.
Better stick
Yeah.
with boohow.
Well, I just think if you're going to be, I mean, massages are such an intimate thing anyway. It's always good to sort of know what's on the menu. But
Yeah.
it's hard when there's a language barrier. I
Right.
understand that. I was never a big massage person, but when I was at that retreat that I went to, I tore my soleus muscle, which is one of the calf muscles. The first movement of the first exercise of the first day. And I was like, I'm not going to be that guy that's going, ow, my leg hurts. And so I did all of the things that we were doing that day and just in agony. But I was damned if I was going to show it. But that night I had a massage scheduled, and I had this big, well, I don't want to say big, but she was big boned. I mean, she was very strong woman named Marty, and
Oh, for God's sakes, throw Marty.
yeah, no, she was awesome. She was awesome. Marty, I will love Marty till the end of my days, because I told her what had
Husky
happened,
Marty.
and she said, well, she was just strong.
Yeah.
She's physically strong,
Right
and she said, "Do you mind if I use hot rocks on you?" And you always see those pictures, but they're static. It just looks like people are laying there and they're just placing rocks on them and leaving them there. Yep. And I said, "Sure." And she got out this rock and lubed it up and just went to town on my leg, just scraping it from the
Like
top
blading,
to the bottom.
yeah.
Yeah, blading. That's what she was doing.
Gua
with it.
sha.
Yeah.
That
Is that what it's called?
It's gua sha, yeah.
Okay.
Blading.
And But she bladed the shit out of that leg, and I'll be damned if, I didn't walk out of there with 90% pain relief.
Wow.
And then the next day I did sort of a Western thing. I saw the physical therapist, and he dry needled me. He stuck acupuncture needles in, and then hooked me up to electricity. And I posted a video of that with my leg twitching with the electricity, twitch, twitch. And then the rest of the time I was fine. So don't shit on massage therapy. It really is real therapy if you get somebody that knows what they're doing.
Yeah.
And physical therapy, if you have an injury like that, I highly recommend physical therapy. People go, oh, I'm not going to do that. No, they really do great work. Physical therapists do great work. So, and then there's a whole medical subspecialty based around that called physiatry or physical medicine and rehab, which they have a problem because when I say I'm going to send you to a physical medicine rehab physician, they say, well, I ain't going to no nursing home. It's like, no, that's the name of their specialty. But anyway, all right, very good. I had something else that we wanted to talk about. You guys been noticing these drug shortages?
Yes.
I mean, it's insane, right?
Yes.
I started saying, well, it feels like we're in a third world country, except I had a guy interview with us, a doctor who, if he comes to work with us, Mel B, you're going to really like him a lot. But he has 7 kids, and they spent 4 years in Tanzania. He said, you don't know what third world is, So okay, we're in a second world country when it comes to these drug shortages because we have patients who need dronabinol. They have chemotherapy-associated nausea, or they have wasting syndrome from their cancer, or they have HIV and they have wasting syndrome. And dronabinol is an FDA-approved version of Delta-9 THC. And it is synthesized in the lab, so it's legal. It comes in 2.55 and 10 milligrams, so it's legal because it's a quantifiable amount. And it's legal in all 50 states, except now we can't get it. You can't get it anywhere.
Wow.
Nowhere can it be found. It's only made by one manufacturer. And this is one of the problems in this country is these things have gotten so consolidated. If the one manufacturer screws up with the FDA and the FDA shuts them down for quality reasons, then nobody gets anything. I mean, try to buy a resistor from a factory made in the United States. It's impossible. There's no such thing. No. It's all made in China.
Yeah.
So a lot of these pharmaceutical companies, and one of the problems is, and I'm going to get shit for this, is that we don't allow them to make money. Now, Pfizer, obviously an exception, but some of the prices that they can charge are actually less than what it costs them to make it. So they just go, fuck it, we're not going to do it. So, but anyway.
I think it'll be worse. I was at ASCO, the American College of Society, or Clinical Society of Oncology. National conference 2 weeks ago. And a lot of drug development and clinical trials, especially surrounding gastric cancers and certain lung cancers, is happening in China. And they have really remarkable therapeutics that we really need. But I think the pipeline on getting those drugs actually here and approved here is going to be significantly delayed.
Well, can we not make some things here? I mean, I think we should be, if a company here comes up with something, yes, they should be able to sell it in other countries and they should be able to make a profit and all that stuff. If it's made in Belgium or China or somewhere else, we should have access to it as well. There should be a global market for that stuff.
I've seen some nonprofits that are working on that, where drugs are available in the United States, but not necessarily in a European Union country. So certain nonprofits will work on that. And then the FDA has the early access program, fortunately, but it's a lot, and it delays patient care.
Why are we allowing these delays? That's the thing.
Yeah,
is this Paul Abramowitz? He's a CEO of this ASHP. It's don't worry about what it is, but he's a spokesperson. They track drug shortages. It says some of the most worrying shortages involve generic, sterile, injectable medications, including cancer chemotherapy drugs and emergency medication stored in hospital crash carts and
Yep.
procedural areas. Come on.
Gets rationed between who's cured of intent and who is not. Fortunately, we don't have to do that in our area, but it's certainly
This is
existing in the state.
unnerving. This
Yeah.
is really unnerving. And what's the injustice that I see in my practice is with the dronabinol shortage. We just go right over the line in Virginia. Virginia residents can just go to a dispensary. So they're okay. It's more expensive. Their insurance doesn't cover it, but they can get it. But their friends who live just over the border in Tennessee see their friends going to the dispensary, but they can't.
Right.
Now, the good news is that the DEA has recommended that marijuana be rescheduled from Schedule 1, meaning it's illegal, to Schedule 3.
Okay.
So it will be prescribable. The FDA can't approve it unless they change their rules, because they have certain rules about what they can approve, and you have to have a quantifiable ratio and a quantifiable amount, plus or minus a certain percentage. You can't do that with a plant. But it's going to be really interesting to see how this plays out, because all these places selling Delta 8 and all that stuff, they're going to knock them out of business when the pharmacists have to be the ones that dispense this stuff. Because a Schedule 3 drug has to be dispensed by a pharmacist. So, but it'll be legal everywhere. So we'll see. Now, the states still will have some say over it.
Yes.
States can have the right to take a Schedule 5 drug and make it Schedule 1 if they want to. You know, gabapentin is not a scheduled drug in every state. But in Tennessee and Virginia, they rescheduled it to a Schedule 5 or whatever. So now it's a controlled substance. So, yeah, interesting.
We definitely see it.
Seems like there's some easier ways to go about these things.
Well, I'll tell you one thing. You know, I've become one of those people I used to make fun of. You know, I'm pushing lion's mane mushrooms on my patients and stuff like that for their neuropathic pain.
Right. Yeah. There are a lot of other options.
And
out
reishi
there.
and all
Reishi
kinds of
mushrooms,
things.
yeah.
Good.
There are a lot of other things out there that do work.
Yeah.
It just takes it takes a lot of the Western providers being okay with learning about these things and being okay with suggesting them and not prescribing them and saying, look, you know, there may not be perfect, you know, research on this, but we've seen some things, and I know some people that have done pretty well with taking these supplements or having these other treatments.
Well,
you know, and not feel bad about it, not feel like they're,
My thing was always, if it's not going to do any harm,
Exactly.
it might do some good. But there is decent data on things like lion's mane extract. You don't want the powder; you want it extracted. The chitin in the body of the mushroom can prevent some absorption of some of the good stuff. So I just extract mine. I do an alcohol extraction, then I do a water extraction. And, I've just got these bottles of lion's mane extract lying around, but you can buy it. You just buy it at Amazon.
Right.
And it's anecdotal, N of 1, you and I recorded my final performance on the piano because my neuropathy had gotten so bad. I'm ready to re-record it and do the whole piece now. I only did
Nice.
2/3 of it. I can really, it's amazing the difference. And I've suffered from this neuropathy for years,
Right.
and alpha lipoic acid and glutamine and those kinds of things really helped a lot. But the lion's mane kind of pushed me over the finish line.
And then wild.
So, and I used to make fun of people. It was, oh yeah, mushrooms, go fuck yourself, But now I'm that guy.
Yeah. Have you researched amygdalin at all?
Little bit.
Or apricot seed?
Yeah, a little. Well,
It scares me.
yeah. Now, Laetrile was developed from the apricot seed, and all the data I've seen on it is that not only is it not helpful, but it can be
Quite harmful. Yeah.
But people back in the 70s, particularly, were going to Mexico to get Laetrile treatment because, frankly, at the time, the chemotherapy that we were doing and the quote unquote cobalt treatments and stuff were pretty barbaric.
Right.
I had a patient taking this over the counter, or Amazon delivery amygdalin.
Yeah.
And it essentially gets, when you take it through the GI tract, right? Not as IV, but when you take it through the GI tract, there's strong data that it gets metabolized into cyanide.
Right. It's
and
cyanogenic
this patient was
glycoside.
in fulminant liver failure.
Oh, wow.
of course, it takes a long time to get cyanide levels back on people, and we didn't even realize she was taking it. She was
Right.
a metastatic breast patient, but anyway, it just really concerned me that this is on the market. You can purchase it.
Right.
Certainly for healthy people, you could probably process it and be okay, but for unhealthy people,
What I've said for, and I'm just looking at this amygdalin, natural cyanogenic glycoside occurring in the seeds of edible plants, bitter almonds, and peaches. It's medically interesting but controversial, as it does have anti-cancer activity on one hand, but is also toxic because when the our body's enzyme degrade them, it produces hydrogen cyanide.
yeah.
Which is, deadly. So these things are fascinating molecules that need to be studied, but it breaks my heart that people are in a situation where they feel like they have to go outside the medical system to get stuff. Kratom is a good example of that. Kratom is a fascinating molecule. It has mu-opioid receptor activity, just like morphine and hydrocodone or oxycodone, but also is an alkaloid, so it's got all sorts of, alkaloid-type activity. And I have people writing me saying, hey, I was addicted to oxycodone, and I got off of it using kratom, and but now I'm addicted to kratom, or whatever, or some people have had some good successes with it, but it bothers me that people feel like they can't just go to the medical profession to get this help, that they have to go to like a head shop and just take their chances, and same thing with psilocybin for PTSD.
So effective, or can be.
Yes,
Yeah.
the data is good, and if you choose your patients correctly, and we will have it, but there are people out there with severe PTSD, and the drugs that we have and the talk therapy alone may not be enough. And so they're having to go buy magic mushrooms from Joe down the road.
Figure out how to microdose.
And right, and have to do it on their own, and they're on their own, and that's the part of it. I don't mean that I need them to come to me and let me bill them, but I just don't like it for people to be on their own trying to take care of this stuff because they're so desperate for relief, and they can't get it.
And it's a population that should be like one of the forefronts of our attention.
Correct.
With the suicide rate being so high.
Correct.
So, I agree.
Yep.
Give thyself a bell.
All right.
Depressing.
That sucks.
All right. Anyway, okay, I'm off my soapbox. You want to take some questions?
Let's do it.
Yeah.
All right, let's do it.
Number one thing, don't take advice from some asshole on the radio.
All right. How about this one?
Hi,
Hi.
my name is Alexander. I'm calling because I would like to know if untreated allergies can cause nasal pharyngitis. Please let me know. Thank you.
Yeah, absolutely. Mm-hmm. Yeah. One of you guys, I've been talking enough. One of you guys want to take that?
Melby, you want to
You're talking about post-nasal drip.
Yeah. And inflammation. You want to take it, Melby? Or?
Yeah, I mean, the answer is yes.
Yeah, so you get this like continuous
Yeah.
release of histamine. You get cobblestoning in the back of the throat, so inflammatory changes, hypersecretion.
Drainage, nausea, it all comes with it.
And there are many ways to treat it. I mean, other than just an antihistamine, a prescription
Just.
medicine. There are nasal sprays that you might find online, like Simply Herbals.
.net, yeah.
.net, yes, that's an excellent nasal spray that's healthy for you. The nasal lavage, you can wash the crud out of your head, like Melby was probably remembering. And,
Never do again.
And speaking of Chinese, there are some old Chinese herbs that are pretty good for nasal stuff. Actually, I took
Like
some
what?
this morning.
Astragalus.
Astragalus is
God
one that I
damn
love.
you.
It's the best.
Astragalus.
It's the best. It's
So
the
I think the question would be, is it dangerous to not treat it, right?
Right.
Well, it depends on how fucking miserable you want to be.
Well,
And
the question
you can't
being,
breathe or
if
can't
you
breathe.
leave that inflammation alone, could it lead to head and neck
Right.
cancer or something like that? I don't think there's any
Or
evidence
just
of that.
infection, secondary infections.
Post-nasal drip, it just wears
Annoying.
it just wears away the mucous membrane, and when it's exposed, then it gets inflamed and it gets painful. And so, yes, absolutely. So you want to get that treated. And there's lots of, if you have chronic post-nasal drip, there may be something else going on in there. You could have a nasal polyp or a concha bullosa or something like that. So let somebody look up there. Your primary care should be taking out a speculum and actually looking in your nose with a light. And if they're not doing that, get them to send you to an ear, nose, and throat doctor and get that looked at. Okay. But sometimes just a little Flonase, a little nasal steroid will take care of it. What are you going to say, Mel B? You just got
Just
that
thinking
look in your
about
face.
putting things up my nose.
Oh, yeah. She loves
No,
it.
she hates that.
My
Yeah.
very favorite thing.
Right. She hates it so much that we had the inventor of the Navage on our show, and we convinced her to try a Navage. Yeah, we got her
I
own
did
unit.
not puke.
You didn't?
I
Good
did
job.
not. No.
Oh, she
And it
wanted
felt-
to.
That's what she said.
I was drinking tequila. I
She
had to
wanted to.
Get some liquid courage.
And it felt good, though, right?
It did. I've never been so opened up in my life, and never since,
Yeah.
but never done it again.
Okay.
It is sitting in the cabinet.
I had
at
an
home.
ex-boyfriend who used to snorkel me. Have you guys heard of that?
Snorkel.
Just randomly put his mouth over my nose when I least expect it and
and then
blow.
blow. Oh, and
So
then
annoying.
and it makes you snort sort
Yeah.
of like a,
Yeah, and then the air has to escape.
Right. What an idiot.
We're gonna have
No.
to do a whole
I
show
had-
of Lydia's weird
Guys,
Weird thing.
experiences.
weird.
Yeah.
No, I thought I was.
Did he
weird,
make you
but no.
queef when he was like,
oh God. Ew.
I mean, if he was blowing
I told you what makes me gag.
Oh no.
if he was blowing in
Gross
your
men.
nose, would he not blow
Oh Lord.
Okay.
the thing about, okay, so PA Lydia is sitting in GVAC's chair. And GVAC, one of the things that was fun about him is we could make him gag pretty easily when we started talking about scrotums and stuff like that. I know exactly what makes PA Lydia
Yes.
puke. And I won't do any of the other stuff,
Thank
but I know
you.
what the other things are
Yeah.
too. So anyway, so I have it. So
now
that
I've
was a
got the
big no.
image of like him making me
Yeah, but the
queef. Thank you. It's fucking disgusting.
when I huff and I puff. But it was. But him blowing in your nose wasn't a deal breaker.
So weird.
Yeah, but and evidently pulling her panties down without permission and
Yeah, and
humping
just-
her
and laying on top
is
of her.
Not a deal
That's
breaker. So I'm kind of
I'll give you a tip for that.
I'm kind of yeah, she actually pays extra for that. That makes me.
So you write this
what
stuff
can we do to
down.
Lydia that would really piss her off? That's what I want to know. That would make her run away.
All right, here we go. You ready?
I don't think so.
Calling. Hope everyone is doing well.
Hey, thanks.
I had a
man.
question about getting blood drawn.
Okay.
At your local lab or wherever else. In the past I've had an issue with dehydration, not drinking enough water before going in, and either they had trouble finding the veins,
Yep.
or the drawing was really slow, like trickle thin.
Yep.
And I just got out of it a little while ago, and the same problem came up where they tried a vein in one arm, didn't seem to catch, tried the vein in my other arm. Flow was good for the first 2 vials, but the third one was just a struggle, a slow drip. And between yesterday and today, I must have drank like gallons of water. Like, I'm sure it was overkill, but I am just shocked that it was a problem. And the
He's trying to increase his blood
there,
volume.
I've seen her before. She's great. I don't want to call it, technician error, but I'm just curious. 2 things. One, is there anything else I can do pre a blood drawing appointment
Yes.
to make sure that this doesn't happen? Stay hydrated. How much hydration is enough?
No.
Should I try to get the blood flowing? Maybe do a couple of jumping jacks? I know it sounds silly, but would that help? And then second, I wonder if you could tell me what it is meant by a blown vein. When I was there a few months ago, the tech was having
What did he say?
a different tech was having
Blown vein.
much
Oh.
more problems.
Okay.
Someone casually mentioned that, it was the blown vein.
Okay. Well, yeah, we've got that. So, PA Lydia, you were never a nurse,
No.
but Mel B was a nurse for X number of years, 15, 17 years before you went to nurse practitioner school.
Like 5.
Oh, only 5? Oh, okay.
Don't
Well,
answer.
Also,
No,
But anyway.
no, about 7 years.
Okay, so this you can answer. Absolutely. So difficult, not only blood draws, but sticks for IVs. So talk about that for a minute.
Well, some people just have deep veins,
Yep.
and the needles are small and short. And sometimes it's just hard to get deep enough. People that are large in size tend to have deeper veins. So that's part of the problem.
Right. Well,
And
they have
then-
more overlying tissue. Yeah.
Right. And then you're also trying to hit a little tube that you can't see,
Right.
that you can just feel.
Right.
So it's a gift, and some people just have it and can visualize these things. And
In the hospital, there's always that one person. When you have trouble getting something, they say, "Oh, call Sally June from the 5th floor. She'll come down and do it."
yes,
Some people just have a sixth sense for that. I have a weird sixth sense that I can usually, if someone comes in complaining of pain, I can put my finger right where it hurts. Is it hurt here? And it's almost right every single time.
Yeah.
And some of that is just intuition because I understand the anatomy and where
you
pain
can
comes from and all that
visualize,
stuff. Right.
You know, you can kind of imagine what you can't see.
Right.
And some people just can't do that.
Right.
Nurses are the same way. Some nurses can, and phlebotomists can
Yep.
picture what they can't see and imagine it there, and then you can hit the vein every time.
There
Why
are
do
some. Yeah, go ahead.
Why do you think sometimes it's a slow drip?
Oh, I know.
Just
It's fluid dynamics.
Vacuum? Okay.
But you don't think it's maybe like the angle of the needle
Yes.
into the
Yeah.
vein,
That-
or possibly
It could be
or-
a lot of things. So the needle has a little hole on the end of it, and it's at an angle.
angle, right.
You know, you've got a tube,
Has a bevel
and it's
on it.
not on the end of the tube.
Right.
It's the end of the tube's at an angle, so it's turned sideways. And if you have that pressed up against the inside,
slow it down too.
it slows it down because you're not getting a full flow
or
in
if you're
there.
not fully in it, or if because of the vacuum, the vein is collapsing because veins are thin-walled and they are a little bit collapsible. Some people may have more collapsible veins, that kind of stuff.
What about if you have thick? I don't mean to keep interrupting you, but
No,
what
no.
about thicker blood? I mean, if someone has a little bit thicker blood?
The whole sort of concept of blood viscosity is a little bit of a myth. I mean, it's true that some people have slightly more viscous blood than others, like if they're dehydrated or something like that.
Myeloma.
And yes, and then people who have blood disorders, but the amount of viscosity difference, it's not like the difference between water, say, and honey.
Okay, got it.
You know,
got it.
it's you would have to, you may even have to put it in a machine to measure
the
it to be
difference,
able to tell the difference.
Got it, thank you.
But a blown vein, then talk about what a blown vein is. That's just one where
That's
somebody
just-
fucked it up.
Yeah, that's just where somebody screwed up.
They put a hole
went-
in the vein
yeah.
and it leaked.
Right. And basically you have a bruise now.
Yeah.
So, and your body clots and it stops these things so that you don't bleed to death from
Hopefully.
a blood draw, right?
But you can get a blood vein from drawing blood and from an IV, getting fluids and stuff.
You can get a
Oh,
blood
blown-
vein.
a blown vein.
A blown vein.
A
right?
Oh yeah,
blood
yeah,
vein,
yeah, yeah,
yes.
yeah.
Both.
No, absolutely. Of
It's
course.
just you can either go into the vein and then come out and it bleeds until it
Or go
clots,
through and through.
or you go all the way,
the way through
through
it.
the vein,
Yeah.
and then you've got blood coming out the other side,
Right on.
and it just leaks.
Yeah.
And,
They do have ultrasound.
Right.
Have you ever? Did you ever use that?
I used a vein finder. And
Yeah.
it's like a light that
Like
makes things
projects
glow.
a map onto the.
Yeah.
Okay.
I tried to hold one of those for a nurse who was trying to get IV access on my daughter and passed out.
Oh, rats.
You passed out?
I did.
Oh, rats.
Embarrassed my poor kid. She was
Oh,
so
my
sick.
God.
I don't do well with my own
Way
blood
to make
or
it
the
all
blood
about
of my
you,
children.
Mom.
Yeah, that's pretty much
Yeah,
what
that's
she
what I was
said.
thinking. All
Yeah.
about you.
But it was. I did. I passed right out. I
no-
don't deal well with their blood or mine.
Yeah.
But no, I've used a vein finder. I've used it for myself. I never really found them really helpful because I'm one of those people that can
You can
imagine
do
it,
it, yeah.
that can see it. And it's like the one nursing thing I could do really well.
Now I used to have really
That
good
was just
veins,
that
and
one
I'm
thing.
I'm not a big person.
I can see
so,
your veins from over here, and it's getting me very excited.
Boy.
I gotta go.
But one of the
Scott,
things
let's see
that you
yours
can
over
do,
here. Nice.
if they're going to draw blood out of your arm, one of the things that you can do, jumping jacks won't do it, but what you can do is stand there, make a fist, and spin your arm around like, what was that?
Like a softball pitcher.
He-Man
Centrifugal
doll or
force.
something
Like a
like
softball
that.
pitcher.
Yeah, like a softball
like a
pitcher.
softball pitcher,
But go
yeah.
round and round and round and round. And through
Windmills.
centrifugal force, you will fill up the veins in your arm, and you can see them standing out, and it makes it easier, an easier target.
Use gravity is another trick. If
Yep.
you've got somebody that's frail, elderly, very dehydrated, very, very sick, You can use gravity and let their arm
Sure.
dangle down, because then the blood, kind
And then
of
they put the
pulls.
tourniquet on, and the tourniquet is there because arteries are muscular, high pressure vessels. They can push blood past the tourniquet, but veins are thin, low pressure, thin walled vessels, and they can't push blood as easily past the tourniquet. So you get more blood going in than you get coming out. Sounds familiar to the men out there who are taking Viagra and stuff like that, but the veins will pop out, and then you can. That's why they do that anyway. So, all right.
Getting very excited over here.
The veins.
It's funny what you get excited about. All right. This person I think called for. Let me see if we got time for this. We do not. We'll do this one on the podcast. And check out our podcast anywhere where you find podcasts. Let's do this one on poison ivy, though.
Hey, Dr. Steve, it's Matt in Charleston. How are you?
Hey, Matt. Good, man. How are you?
That's good. We're doing good here.
Good, man.
Hey, so I'm dealing with some poison ivy. It's like a repeat issue for me because I spend a lot of time outside in the woods, and I'm extremely sensitive to it.
Yeah.
I've been hospitalized with it before, where they've given me IV steroids to help flush it out, and obviously topical stuff. And I'm wondering how rare that is, or if that's all in my head or crazy.
Oh.
And also, how does calamine lotion work? Does it just suck moisture out of your skin, or is it magic, fairy farts? What the hell is going on with calamine?
Yeah, calamine just basically dries things out. That's its role. And there'll be calamine with Benadryl in it, or diphenhydramine, which people think, oh, well, this is going to be better because it's got anti-itch stuff in it. Actually, topical diphenhydramine or topical Benadryl can be activating and actually make it worse. So if you need an anti-itch and you want to take diphenhydramine, which will make you sleepy, and if you got an enlarged prostate, it'll affect your ability to urinate. But if you can take it, it's pretty good for itch, but take it orally. Don't put it on your skin. But no, it's not in his head. It's obviously real. Just get on steroids from the second it starts, and then you'll know. Yeah. Till next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.